Hello, this is a recording of the Nursing Skills Lecture on Activity based on Chapter 32 in the Fundamentals of Nursing, the Art and Science of Patient-Centered Care. In order to prevent injury to your patient or yourself, a nurse must be very aware of their movement and alignment. Proper body alignment or posture permits optimal musculoskeletal balance and functioning. To improve balance, make sure your center of gravity is close to the ground, your feet are spread apart, creating a wide base of support, and your hips and knees are flexed. Try to make sure your movements are coordinated by using the major and stronger muscle groups in your arms and legs. Be aware of your body mechanics, the use of proper body positions to provide protection from the stress of movement and activity. And be aware of patient care ergonomics, which is the practice of designing equipment and work tasks to fit the capability of the worker in relation to patient care. In 2010 alone, there were 654,000 healthcare workers that were injured on the job, compared to only 502,000 manufacturing workers, even though those manufacturing workers were lifting large, pieces of cars and equipment. Just moving people, the healthcare workers have a higher rate of injury. Healthcare workers are actually likely to experience 7 times the national rate of musculoskeletal injuries. For health promotion and maintenance, you want to be aware of the different types of exercise and the effects of exercise and immobility on the body. So exercises can be categorized by muscle contraction. Isotonic exercise involves muscle shortening and active movement, such as walking and swimming. Isometric exercise involves muscle contraction without the shortening and with minimal movement, such as yoga poses. And isokinetic exercise involves muscle contraction with resistance provided by an external device, such as continuous passive motion or passive range of motion offered by a nurse or a physical therapist. So you want to be aware of the effects of exercise on the body, because that can be seen in almost every system: the cardiovascular system, respiratory system, musculatory, musculoskeletal, gastrointestinal, your skin, and psychosocial outlook. Table 32.4 on page 1048 breaks down the effects of exercise and immobility, and you should be reviewing this and be aware of all those different effects that exercise or immobility have on the body. In terms of teaching your patients, you want to be aware of what the CDC recommendations of exercises are. For children and adolescents, they suggest 60 minutes of moderate to vigorous exercise a day. And for adults, they recommend either 150 minutes of moderate intensity aerobic physical activity per week or 75 minutes of vigorous intensity aerobic activity in combination with muscle strengthening activities 2 or more times a week. So proper body mechanics to prevent injuries involve these following principles. You want to have an erect body posture. Use the longest and strongest muscles of your arms and legs. Use the internal girdle and long midriff. Work close to the object being moved. Avoid twisting your body. Slide, roll, push, or pull rather than lift. And spread your feet to shoulder width. And if possible, break up heavy loads into smaller loads. So in lab this week, you're going to be practicing repositioning each other, working with another student and lifting another student in different positions, from the bottom of the bed to the top of the bed, from a bed to a stretcher, from a bed to a wheelchair. So all these things you're going to be working on, and it will make more sense when you're putting into action. So in repositioning a patient, the maximum amount a healthcare worker should lift is 35 pounds. And when lifting a box with handles, the maximum weight that should be lifted is 51 pounds. There's some myths that I would like to talk about in terms of proper body mechanics. One is that good body mechanics alone is shown to prevent injuries. This isn't true if you're trying to lift too much or haven't totally properly assessed the patient or the situation that you're trying to do the lift in. Use of lifts is necessary, again, if the amount of weight you're going to be lifting is 35 pounds or more. Athletes are less likely to hurt themselves. That's another myth. Many people who are athletic tend to overestimate their strength and try to do things more independently. You really need to be working as a team and preventing injury by not trying to overdo or fatigue yourself. Mechanical lifts are too expensive, which is another myth. They are expensive, but if you consider that one back injury costs up to $40,000 and costs the person wages and income and can be very expensive in several ways, a mechanical lift is not too expensive. Another myth is that if you buy a lift, the staff will use it. This is not true necessarily because staff needs to be educated on how to use it. It needs to be in good working order, and you need to have the accessories such as lift pads available when you need to use them. So all of these things you must consider in terms of body mechanics, in terms of using equipment, and in terms of not fatiguing and overdoing lifting too independently. It's up to nurses to protect certified nurses' aides and direct care workers in addition to themselves. So when you're going to lift, make sure you do all these steps. 1, plan your lift. 2, ask for help. 3, widen your base of support. Bend your knees. Tighten your stomach muscles. Lift your leg muscles. Lift with your leg muscles. Keep your load close and keep your back straight. And follow these steps for safe patient transfers. Assess your patient. Be aware of the patient's medical conditions and physical and mental ability. Ensure that there's enough staff available. The person needs to wait. If the person might ring the bell and ask you to help you to the bathroom, have you help them to the bathroom. Don't do anything that's going to put yourself in jeopardy. Ask them to wait a minute. You'll be right back. Go get some assistance. Plan and communicate before moving the patient. That way you're working together, coordinated, and the patient knows what to expect. Medicate the patient for pain before moving them if necessary. Keep the patient in good alignment to protect them from injury. Use friction-reducing devices. You'll see some examples of that in the nursing lab. And move the patient in smooth, rhythmic motion. That takes communication. Use lifts, slides, transfer chairs, and gait belts. So you want to be promoting correct body alignment for your patients. You can use this through the use of positioning devices, such as pillows, mattresses, trapeze bars, footboards, bed cradles, trochanter rolls, splints, and hand rolls. If you're not familiar with any of these items, we have them in the nursing lab, and please ask and we'll show you. The footboards can help prevent foot drop. The trochanter rolls help keep alignment of the hips after hip fractures. Hand rolls and splint help prevent contractures of the hands and arms and different body parts. So these are very important ways of protecting your patient and promoting correct body alignment. There's also protective positioning. There's 2 places in your textbook that show different illustrations of these different positions on page 1068, table 32.6, and also on table 25.2 and page 634. You can see these different positions. They include Fowler's, which is sitting up in bed. That could be a low Fowler's at about 30 degrees, semi-Fowler's, about 45 degrees, or high Fowler's. And that promotes cardiac and respiratory functioning. Supine is laying flat on the back with your heads and shoulders slightly elevated, legs extended. That facilitates abdominal wall relaxation if you need to assess someone's abdomen. Dorsal recumbent position is when you're laying flat on the back with your head and shoulders slightly elevated, the knees flexed, and the soles of the feet on the bed. And that helps with certain procedures such as inserting a Foley catheter, which we'll learn about soon. And side lying or lateral position is used for assessment of the rectum and vagina. And the prone position, with the patient on their abdomen with the head turned to the side, is a comfortable position for patients who don't have restrictions, but would be contraindicated for patients with spinal problems. So there's a lot of implications for different positions and a lot of reasons to prevent positions for certain patients. So it's important to read through Table 32.6, page 1068, to familiarize yourself with some of these considerations. And then you want to do log rolling for the patient who has a spinal injury, and that's also described in the book. And that's when you're turning the entire body in one position so you're not putting any pressure or misaligning the spine for a patient who has an injury to that area. For the person who needs to start walking again, let's say they had surgery or a back injury and have been laying flat on their back for an extended period of time, there's different exercises to help a person become strong enough to ambulate again. These are the quadriceps and gluteal drills, push-ups, and dangling. And the book does a good job describing all these different types of procedures that you do and teach a patient. Once the person is able to sit up and start standing and taking some steps, you want to use mechanical aids, walkers, canes, and crutches. If through your assessments you determine a person actually has impaired mobility or a risk for impaired mobility, or they have a problem related to impaired mobility, you're going to want to create a nursing diagnosis related to this issue. These are some examples: impaired physical mobility related to altered neurological functioning, as evidenced by left-sided weakness. Or if it's the second one is an example of a related problem, it would be impaired skin integrity related to altered mobility, as evidenced by a stage 2 pressure ulcer on the coccyx. Or this is another related potential problem, ineffective tissue perfusion related to potential for thrombus formation related to altered mobility. Or psychosocial consideration, the self-care deficit related to left-sided motor and sensory deficits, as evidenced by inability to ambulate. So if this is the case, then you're going to want to develop a goal or an expected outcome. Some examples for the first one, you might want to say patient will remain free of injury through hospitalization. For impaired skin integrity, your goal might be that patient will show signs of wound healing in 1 week. For an effective tissue perfusion, your patient goal or your expected outcome might be the patient will be free of a DVT, a pulmonary emboli, post-surgery through discharge from hospital. For the self-care deficit, your goal might be the patient will demonstrate increased energy for activities of daily living or accept assistance in meeting hygiene needs. So these are all possible outcomes, and they're all patient-related, right? Then you want to implement a plan of nursing interventions. This would include interventions, range of motion, physical therapy, consults, all sorts of interventions that you can do as a nurse. And then finally, you can evaluate the effectiveness, and we do that process as needed. If you have any questions you would like to ask or comments to share about the activity unit, please use the Dropbox on the main page of the Nursing Skills Fall 2017 eClass site. Thank you.